Noticing something abnormal in your child can feel alarming, but conditions like scoliosis are very common, and early detection can help your child thrive later in life. We meet one Valley mother who shares her experience with her daughter, Jolene, hoping to help other parents know what to expect if their child is diagnosed with scoliosis at an early age.
Just any normal 6-year-old, pretty rambunctious. She keeps me busy, but it has not held her up in any way.
Jodon's daughter, Jolene, was diagnosed with scoliosis by her pediatrician years ago and was referred to pediatric orthopedic surgeon Dr. John Wiemann.
Scoliosis, for the most part, in otherwise healthy children is all genetics, but it has nothing to do with any kind of activity that one would do as a child. Typically, on the early side, there's not any kind of physical symptoms, so children will be able to continue playing sports and doing normal activity, and then it's not until after it gets fairly severe that they have symptoms such as pain or nerve issues, and so that's why we like to screen for them as they're growing to make sure that we don't miss it when we could possibly prevent progression to needing surgery.
Jodon was diagnosed with scoliosis as a child and needed to undergo corrective spinal surgery. So, when she noticed curvature in her daughter's spine, she immediately knew where to turn.
For kids that are under or that are completely skeletally immature, such as Jolene, then if we are able to put them into a brace, then that reduces the risk of needing surgery by about 50%.
Jodon says Jolene only has to wear a brace at nighttime when she goes to bed.
In the beginning, it was a little rough. She had to get used to it.
The only effective measures are bracing and surgery.
Jolene's mother underwent surgery herself for scoliosis, but with today's advancements in surgery, the operation isn't as invasive as it once was.
So to correct the scoliosis, what we do is place screws into the pedicles here. After about 4 weeks, they're able to go back to school, and then after about 2 months, most people are feeling fairly back to normal. Jolene has a juvenile idiopathic scoliosis, so she's a little bit younger than we normally see, and the main issue with that is that at that age she has a higher risk of progression to needing surgery because she has more growth left.
With early diagnosis being key, Dr. Wiemann recommends making an appointment with your pediatrician if you notice any curvature in your child's spine.